Hello and welcome to Prosopon channel. My name is Nancy and in this channel we explore interesting topics around psychology. Make sure that you subscribe to my channel to receive notifications for when a new video is out. Today's topic is post-traumatic stress disorder or PTSD and its treatment. Post-traumatic stress disorder is a mental health condition caused by a traumatic event. A common example is when soldiers come back from a war zone where they usually experience high levels of stress and traumatic events. However, PTSD can also be caused by other traumatic events in life. For instance, abuse, serious accidents, serious health problems such as being admitted to intensive care, difficult experiences during labor or losing a baby, among others. Some of the symptoms that a person who suffers from PTSD can experience are nightmares, vivid flashbacks, feeling like they relive the traumatic event, panic attacks, depression symptoms, avoidance of reminders, emotional distress, difficult concentrating and sometimes they need to ask the same question again and again, intense distress, intrusive thoughts or images, and isolation. The reason why some people develop PTSD is because the traumatic event they had is beyond normal experiences. The traumatic event can happen quickly and suddenly, they feel intense threat to self or other, and it can cause the person to freeze. There is also a neurological explanation, and that is of the information processing in the brain. More specifically, the amygdala and hippocampus play an important role. The amygdala is the alarm system of the brain, triggering the fight and flight response. The hippocampus, on the other hand, is in charge of filing our memories, tagging the time and place. However, during a traumatic event, the hippocampus goes offline and is confused as to where to save the information. As a result, these vague memories might be stored in our brain. Eye movement desensitization and reprocessing therapy or Emdr can help the patient in various ways. Emdr is accessing and processing the disturbing event. More specifically, the therapist will explore the client's trauma and will encourage them to experience these emotions in the present. The idea is that this process will help the person to unfreeze their memory from the traumatic event. Then new association made with previously disconnected information. That is called exposure to the memory and desensitizing. EMDR aims to assist the person cognitively to reorganize their memories and thoughts and try to add a narrative to it. EMDR also aims to desensitize stimuli that triggers present distress and to incorporate adaptive attitudes. For instance, if the person thinks that the traumatic event was their fault, EMDR aims to assist the person to rethink the reality of the event. By asking the client to experience traumatic emotions, the therapist aims to make this imagery become less emotional and vivid. The eye movement reproduces a brain state similar to that in rapid eye movement sleep. Rapid eye movement or REM is responsible for dreaming and nightmares. PTSD seems to increase the duration of light sleep and disturbs the REM stage, which is very important for learning, memory, and mood. That can also explain why some people who suffer from PTSD struggle with sleeping. But what to expect in an EMDR session? During the session, the therapist will ask you to focus in the traumatic event while you begin to move your eyes side to side or by tapping your fingers. This technique is thought to be effective because when you recall the traumatic event in a safe environment and with your attention diverted, it can be less emotionally upsetting. EMDR has been effective for treatments such as depression, anxiety, panic attacks, addiction, and eating disorders. Before the client is ready for exposure to the trauma, the therapist needs to know their history, identify the troubling memory, and teach them some stress management techniques. EMDR was developed by Shapiro and it is offered by the NHS as well as the National Institute for Health and Care Excellence, which studies the effects in patients. In our next video, we will explore the rapid eye movement in more depth. We will talk about why this stage of sleep is important, how alcohol can affect this stage, and we will also talk about REM sleep behavior disorder. So make sure that you subscribe to my channel to receive notification for next week's episode. See you next week, everyone. Bye!